Welcome, everyone. Today we're going to break down a condition that affects millions of people but is often misunderstood: cerebral palsy. My goal here is to give you a really clear, straightforward look at what it is, where it comes from, and how it's managed. Let's get right into it.
Okay, so let's start with the absolute basics, the definition. There are a few keywords here that are super important. First, it's about movement and posture. Second, it's caused by damage to a brain that's still developing. Now, the condition is permanent, but, and this is the part I really want you to hear, the original injury is non-progressive. That means it doesn't get worse over time. That's a huge piece of the puzzle.
So just how common is it? Well, the numbers show that cerebral palsy affects about 2 to 3 out of every 1,000 babies born. And we see it more often in babies who are born prematurely or have a low birth weight, which already gives us a little clue about its potential causes.
All right, so that leads us to the big question. Where does CP actually come from? To really get it, we have to look at when that damage to the brain happens.
You know, a lot of people think it's something that happens right at birth, but that's not always the case. Most often, the cause is prenatal, meaning it happens before the baby is even born. This could be due to an infection, a genetic issue, or just the way the brain formed. Sometimes it does happen right around the time of birth, or even in the first couple years of life from something like a serious illness or head injury.
Now here's a huge misconception. Cerebral palsy is not just one single thing. It's really more of an umbrella term that covers a whole range of disorders. We generally break them down in two main ways. First, by how it affects movement, and second, by which parts of the body are involved.
So if we look at the different types of movement issues, one really stands out. Spastic CP is by far the most common, making up about 3/4 of all cases. If you hear the term spastic CP, think stiff, tight muscles, which can make moving around pretty challenging. Let's dig into these a bit more. That spastic type with the stiff muscles, that's caused by damage to the brain's motor cortex, which is like the main control center for movement. Then you have dyskinetic CP, which involves involuntary movements. That's linked to damage in a different area called the basal ganglia. And finally, there's ataxic CP, which causes shakiness and balance problems. That one's tied to the cerebellum, our brain's hub for coordination. The other way we classify CP is just by looking at which limbs are affected. It's pretty straightforward. Hemiplegia means one side of the body is affected. Quadriplegia means all 4 limbs. And then there's diplegia, where the legs are more involved than the arms. You actually see this type quite often in babies who are born prematurely.
Okay, so we've talked about what CP is and where it comes from. But how do doctors actually figure out if a child has it? Well, it all starts with spotting some early clues.
And this brings us to a question that's on a lot of parents and caregivers' minds, right? What are the very first signs you should be looking out for that might suggest a developmental issue like CP?
Here are some of the key developmental red flags that doctors pay close attention to. Things like not having good head control or still making a tight fist with their hands. An interesting one is a very early preference for using one hand over the other. Now, it's so important to say, none of these signs alone automatically means a child has CP, but they are signals that it's time for a medical evaluation.
This is a really crucial point. There isn't a simple blood test for cerebral palsy. The diagnosis is clinical, which means a doctor carefully monitors a child's development over time, checking their motor skills and reflexes to see if there's a pattern of a motor disorder that, again, isn't getting worse.
But while the diagnosis comes from that careful observation, doctors still need to see what's going on inside the brain. And that's where an MRI scan comes in. It's really the best tool we have to get a clear picture of the brain's structure, confirm if there's any damage, and understand the root cause of the challenges.
So once a diagnosis is made, the entire focus shifts to management and support. It's not about finding a cure for that initial brain injury. Instead, it's about building this incredible collaborative plan with a whole team of specialists to help the person live their best life.
And the goal is everything. It's simple, positive, and so powerful to help each individual maximize their physical abilities and become as independent as possible. It's all about focusing on potential.
And you don't do this alone. It takes a whole team. You've got physiotherapists working on mobility, occupational therapists helping with everyday skills like getting dressed or writing, speech therapists who help with communication and even swallowing, and of course, specialist doctors who manage other related conditions. It's a real team effort.
So let's wrap this up by looking at the big picture. What's the long-term outlook for someone living with cerebral palsy? Let's talk about the prognosis and the key things to remember.
Well, the truth is, the outlook is really different for every single person.
It depends on a few things, like how severe the movement disorder is and if there are other conditions involved. But, and this is a big but, getting access to therapy and support early on can make a world of difference. The key takeaway here is that many people with CP live full, long, and incredibly productive lives.
I think this quote just captures the modern approach perfectly. It's not about trying to cure something that happened in the developing brain. It's about creating a smart, supportive plan to help someone be as functional and independent as they can possibly be. It's a powerful shift in mindset.
And that leaves us with one final big question. A question not just for doctors or therapists, but for all of us. How can we, as a community, create a world that's more accessible, more inclusive, and more understanding so that we can truly support the amazing potential inside every single person? Something to think about.